Sometimes a stubborn infection can lead to a serious problem. Sepsis, which is an overwhelming infection of the bloodstream that can spread throughout the body, is the 10th leading cause of death in the United States. Complications like organ damage can even occur if it isn't treated in time. But at Community Regional Medical Center, there is a new device that's increasing the chances of defeating this condition, giving patients a fighting chance in the race against time. Tan Kyam Upatam was working outside his house one day when he passed out and woke up in the hospital. His situation was critical when doctors used a new device he believes helped save his life.
The last time I went in here, I had a blood clot in my vein, and they put a line in and took the bacteria out of my veins, and they made me feel a lot better. The doctor gave me medication and treated me really well.
Increased troponins here, EKG changes.
Dr. Brian Chinook of Community Regional Medical Center knows firsthand how serious sepsis can be. He says it can travel through the entire body, spreading infection quickly and damaging organs rapidly. The severe nature of sepsis requires aggressive action where every minute counts.
The death rate of sepsis, regular sepsis, is around 16%. Severe sepsis, it's about 1 in 5 patients, about 20%. And when you get to septic shock, which is sepsis with hypotension or low blood pressure, the rate is almost 50%.
That's why doctors at Community Regional Medical Center are battling this disease with the early goal-directed therapy plan and increasing a patient's chance for survival.
They're identified, they're in septic shock, they have the infection, they have sepsis, and they have a low blood pressure. They get IV fluids. There is what we call a catheter, which is a tube that's put into the neck veins, and it helps measure their blood pressure. We use that then to direct exactly how much IV fluids we're giving.
And Dr. Chinook says the difference with this catheter is that it gives instant information.
It's a catheter which detects central venous oxygenation. It has, at the tip of it, it has a sensor which can help detect it constantly. This is designed to be an aggressive resuscitation, so by being able to see it at every given moment and constantly monitoring it, we can then give the therapy much more quickly.
One of the biggest concerns when a patient has sepsis is taking care of their blood pressure levels. This therapy sets specific goals to reach optimal blood pressure levels, helping to get valuable oxygen to tissues before significant damage occurs.
It keeps the blood pressure up, it keeps their central venous pressure up. All those things done early will deliver oxygen better to all those important organs like the kidney, heart, and lungs, before it causes significant damage.
Before bringing the treatment here, Community put together a group to ensure patient safety.
There was a multidisciplinary committee formed at the hospital that was headed by Dr. Krista Kaups, who's in the Department of Surgery, and it also involved people from the intensive care unit and emergency department to come up with a set of this order set which can aggressively treat people who have sepsis.
And Tan Kyam is glad they did.
When they put the line to my vein to take the bacteria out of my system, my daughter said that this was my last chance.
A chance he's glad he took. He now enjoys time with his family, which might not have been possible without the forward thinking of the emergency doctors at Community.
I only had 3 minutes to make the decision, but I had to do it. I had to make a choice or I'll be gone forever. So I told my daughter to have the doctors do what I needed to save myself, to make me feel better so I can be with my family.
And he is enjoying his time with his family. In fact, Tan Kyam looks forward to being able to visit his home country really soon. If you would like more information on sepsis, visit our website at medwatchtoday.com.